I think that the relationship between faculty and residents, and also between us residents ourselves, is really one of the strengths of the program here. We are a smaller program, but we're in a really large hospital system, which means that we have tons of attending physicians, and they're all excited to have residents. One of the big benefits of being in a new residency program is that the psychiatrists aren't used to having us around, and so they welcome the extra help with work. They welcome the opportunities to teach. We're usually one-on-one with our attendings on rotations, and I appreciate that time.
It's really nice that the program itself is so small and close-knit because there's a lot of one-on-one interaction with the attendings and the residents. But then in addition to that, we're able to interact with all the Atrium Health providers that aren't psychiatrists, and there's a lot of crosstalk between not just the physicians, but the nurses, technicians, pharmacists, and we learn so much from the other fields as well.
I would say I get easily 30 minutes to an hour of one-on-one teaching every day that I go to work.
When I started looking for residency programs, I was looking for programs that had a diverse experience of rotations and training that would prepare me to be a psychiatrist with as many tools as I could possibly have for my patients. And so when I looked at CMC, I noticed that they actually had an emergency psychiatry rotation, something that a lot of other programs don't have.
So our program is not resident run, but it's attending run, which means that they heavily focus on residency education. And so a lot of places might fall apart if residents are not there, but at this place it runs itself, so that means that we can focus just on our own education and figure out what kind of physicians we want to be.
We are a small program in the sense that we're only 4 residents per class, but we have such great support from our program directors, from the chair, from our program coordinator, that accessing anything within Atrium, even if it's far away, is possible. Like, they help us connect with whomever we need to connect quickly, readily, and they're happy to do so.
The faculty here, they're really invested in having us figure out what we want to do after residency, and so we're really exposed to a lot of different things like inpatient and outpatient, both adults and peds, emergency psychiatry,
and various other trainings such as ECT, TMS. We get training in assertive community treatment, the ACT team, so just a variety of rotations that really prepare us for the real world.
We even have telepsychiatry, which not a lot of programs have.
With it being such a unique time in the field of medicine and psychiatry, I think Atrium is a step ahead of the game in terms of telepsychiatry services and really making ourselves available virtually to patients in the community.
We're exposed to all these different things, and they really focus on what we want to do in the future for the rest of our lives.
I would say the culture is most definitely a culture of camaraderie, culture of support. I love all my co-residents. I think I'm a better resident because of them, because of the environment that I've had. Never felt like I'm burdening anybody, or I've just felt like it's been a very good environment, and I've appreciated that.
When you set foot into this hospital, you can feel the collegiality and the support between faculty, residents, nurses, pharmacists, everybody. So that's what made me decide to come here.
We have a good work-life balance in this residency program.
We really emphasize the importance of work-life balance, and people in our program have families and spouses and significant others, and we welcome all of those people into our program. I think that we all recognize the importance of spending time with all of those people that we love and making memories while we're still doing our training here in the program.
One thing that I think I will carry forward in my practice with me from Atrium is the idea of looking for progressive and innovative solutions to problems. I really value that this program does that.